Good afternoon, everyone, and welcome back. I am happy to be back with you all again. I am Sabrina Cherry, the moderator for this session. Today's session is entitled Integrating Research to Policy Translation Skills into Public Health Professional Workforce Training, an innovative online resource for planning policy advocacy campaigns. Our speakers for this session are Drs. Amanda Raffoul and Bryn. Amanda Raffoul is a postdoctoral fellow with Strategic Training Initiative for the Prevention of Eating Disorders, a public health incubator, or STRIPE. Her research on policy approaches to preventing disordered weight control behaviors is funded by the Canadian Institutes of Health Research, and she's actively engaged in both US and Canadian advocacy efforts relating to eating disorders treatment and prevention. Bryn is Professor of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health and Director of STRIPE. She is immediate past president of the Eating Disorders Coalition, the leading community advocacy organization nationally focused on U.S. federal policy to address eating disorders. I'll now turn it over to our speakers. Welcome to you both.
Thank you very much for that generous introduction. I'm delighted to be here today. I'm hoping that we'll be able to put our slides up for our talk in just a moment. I am Bryn, as you heard in the introduction, faculty at the Harvard Chan School of Public Health and Director of STRIPE, Strategic Training Initiative for Prevention of Eating Disorders. And I'm just so thrilled to be able to present to the SOPHE audience today and with my colleague, Amanda Raffoul. Next slide, please. We have no disclosures. Next slide. Our learning objectives. So first, to explain policy translation techniques to implement advocacy campaigns addressing public health issues. Next slide. To identify 6 key components of the power prism, and we'll come back to that in detail a little bit later, and the contribution of each of the components in designing a public health advocacy campaign that addresses health inequities. And the third objective, to describe the striped advocacy playbook, which is designed to train public health professionals in working with policymakers to advance evidence-informed health policies to prevent eating disorders and promote body confidence. Next slide, please. Now, those were our learning objectives, the objectives for the talk. What I'd like to present now are aspirations for the talk. First, to convince you that to advance evidence-based public policy, public health professionals, including researchers like ourselves, must become versed in the methods of strategic science and use those methods. Next slide. And diverse stakeholders, and that includes researchers and clinicians and advocates with lived experience, all have unique and essential roles for success. Next slide. So STRIPE, as you heard, is the Strategic Training Initiative for the Prevention of Eating Disorders. We are a research and training program based at the Harvard Chan School of Public Health and Boston Children's Hospital. Next slide. Our mission is to train the next generation of health professionals to harness the power of public health to prevent eating disorders and related problems with food, weight, and appearance. Next slide. And we strive to create a society where girls, boys, and people of all genders can grow up at home in their own bodies. Next slide. We'd like to take a moment here to run a poll. Over to you, Amanda.
Great. So we would like for everyone in the audience to give us a better idea of what their primary roles are so we can adapt and speak to your roles throughout this presentation. So again, I know that many of you probably sit in many seats, but please identify your primary role in the poll. Looks like most people have participated. We'll give it another minute. Great, and if we could end the poll and show the results, please. So it looks like most people are other. If I open up the chat real quick, I see quite a few students, a university professor, someone who works in state government public health, and that's alongside everyone who responded to the poll options, including some community public health practitioners, public health educators, and 6 researchers. Great, so we could stop sharing that. And Bryn, back over to you.
Sure, thank you, Amanda. And actually, I just wanted to flag that in the chat, we got an enthusiastic post from a fellow Canadian of yours doing cross-border policy, health policy research. So thank you for shouting out from the audience there. So what I'd like to do now, before we get into the details of our policy advocacy and the training that we offer, I want to tell you a story of odds, arcs, and policy change. Next slide, please. So what are the odds that an impeccably conducted study in a high-impact journal showing compelling evidence that a consumer product is harmful will lead to swift policy action to protect consumers? What are the odds of this? Next slide. Well, I'm sorry to say the odds are just about nil, but let's dive into this a little deeper. Next slide. What about a situation where we may have dozens of studies or maybe hundreds of studies, plus major federal reports and countless US Food and Drug Administration warnings? Would we, next slide, expect to see swift and decisive policy action then? Well, next slide. Sadly, the odds of all that evidence on its own catalyzing public policy still hovers just barely above, I think you'll know what's on this next slide, nil. Hovers just above nil. So next slide. What would most of us scientists or public health professionals say when we hear something like this? Next slide. It's outrageous. It's totally unacceptable and perplexing. That's the thing for us. Next slide. Yes, and next slide. Welcome to the world of diet pills. Everything I just said about how much evidence is out there is exactly our situation with over-the-counter diet pills. And we're going to come back to this in just a moment. Next slide. So before we enter this not so brave and not so new world of diet pills, next slide, I want to say a little bit about an unspoken assumption of many scientists and public health professionals about evidence. Next slide. So we trained for years to be able to accrue the most rigorous of evidence, and we devote our careers as researchers, we devote our careers of accumulating this evidence. Next slide. With this evidence, we imagine that this is going to lead directly to, next slide, to public policy, to policy change and regulation. We accrue the evidence, yay for us, we'll see policy change. And the assumption is that if we accrue enough evidence, it will be through a direct and unmediated pathway of policy change. But let's take a moment to look at this pathway. We trained for years to excavate pathways, to understand the pathways of cause and effect. So what is this pathway? Next slide. Is this pathway osmosis? Next slide. Is it magic? Or next slide, sheer brilliance. I'm sure many of us would like to say it's this one, but next slide, it actually, reality is much more complicated. What I'm going to walk you through now is what we'll talk about is the policy translation arc. And I'll give you 3 steps. First step of the policy translation arc and reality is that we do need to accrue compelling evidence. So all that training we did to be able to create rigorous evidence, it's all good, but it's not enough. It's only the first step. Step 2, generate viable policy options. Critical to do that. And next slide. Step 3, we need to be able to energize political will. With that, next slide, that's what takes us to the policy translation arc. Critical to be able to get evidence-based public policy. Next slide. So before I go on about the arc, I wanted to just take a moment to make sure folks are familiar with the concept of strategic science. Some of you may know Kelly Brownell, a Dean of Public Policy at Duke, and Christina Roberto at University of Pennsylvania. They published in The Lancet just a few years ago a definition of strategic science, which they describe as research designed to address gaps in knowledge important to policy decisions derived from the reciprocal flow of information between researchers and policymakers. And I want to offer one slight revision to add an advocates with lived experience. And then next slide, they go on to define strategic science, that it must be communicated not only in scholarly publications, but also in forms relevant to policymakers, and a little modification here to add, and relevant to advocates with lived experience, critical for strategic science. Next slide. So we talked about the policy translation arc, and now I've introduced strategic science. I want to bring the two together now. So step one, I said, was to accrue compelling evidence. What strategic science helps us do, because of the reciprocal flow of information, that dialogue helps us know what kind of evidence is going to be compelling to lawmakers and community advocates. Step two, strategic science helps us consider the viability from the point of view of policymakers in the community, not just the point of view of researchers. And with step three, strategic science next slide, will help us figure out how to motivate policymakers and community members, chiefly by engaging them in agenda setting from the beginning in dialogue with the work. Okay, next slide, please. Now with that, I'll turn it back over to you, Amanda, and our next poll.
Great. So now that you've seen a little bit about, we've given you a taste of the definition of policy translation and strategic science, and knowing that many of you work in research settings or are students, perhaps conducting research, we want to know what types of advocacy you've actually participated in before we get a little bit deeper into your role as advocates. So please select what types of advocacy you've participated in. I think it's just a multiple choice, but if you've participated in more than one or any others not described in the poll, please feel free to add those in the chat. Okay, and if we could have the results shown to the audience. So half of you have called or emailed lawmakers about a bill. A few people have testified at a hearing. Nearly 3/4 have signed or shared a petition. Just over half as well have attended an advocacy day or meetings with lawmakers. And then a few other folks have engaged in other types of advocacy, which is an incredibly impressive showing, given the variety of people that we have here in our audience today. Okay. So picking up sort of on where Dr. Austin and where Bryn left off, you might have noticed in some of the discussion around policy translation and strategic science that Bryn was alluding to the fact that a lot of evidence that we accrue within public health research doesn't make its way over to policy. Many of us think of that pathway, that magical pathway in which science becomes policy just happens, but it's a lot more complicated than that. And I think part of that can be attributed to the fact that there are pretty significant gaps between public health research on its pathway to practice and the role of advocacy in that. So as Bryn summarized, there is quite a bit of gap between research and practice, because not many of us receive education and tools, which I'll touch on in a second, to be able to translate research into policy. There are also gaps between incorporating research including research in advocacy efforts, but also including the voices of advocates in the research that we conduct. And there's gaps and opportunities for us to do more in the synthesis of these three different elements. Without training opportunities, professionals and students and people coming up in this world of public health advocacy are stuck in their own silos or their own sections with very little translation and minimal impact on actual policies that can make a difference. And so advocacy can be incorporated into public health education. And like many things, we like to think of it as a set of tools. So for example, trainees and folks starting out in public health might learn how to translate their research findings to a lay audience. It's great that we can write a scientific manuscript, but if that information can't easily be accessed or easily be read by folks that are going to be using it, like for example, lawmakers and their staffers, then that evidence can only go so far. Another tool might be how to describe impact. So a study in itself that finds, a very narrow set of results might not have a lot of impact to much of the population until you put it into context. Another tool might be thinking along political lines. So today we're going to talk about some different advocacy issues that we've introduced or pieces of legislation that STRIPE has supported. And one of the tools that I found myself having to adopt to beginning to work in this advocacy space is thinking around how politicians on both sides of the aisle receive information and how they can promote it to their constituents. Other tools that might be useful for people to incorporate in advocacy is working with different groups of people. Again, as you will see, we've begun to work quite a bit with youth through STRIPE and through many of our advocacy campaigns recently, and that requires a different set of communication skills. Now, you don't need every tool in the box if you collaborate across specialties, but we do need to know how to communicate and get involved with people that have the different skills and tools that we need. And so eating disorder advocacy, we're going to dive a little bit deeper into the topic that we're going to be discussing today, is fairly new and yet pretty well established. So the Eating Disorders Coalition, which in the introduction was mentioned, Bryn has done quite a bit of work with, organizes, for example, an advocacy day so that people from around the United States have the opportunity to engage with and conversate with lawmakers about their experiences with eating disorders or their knowledge of eating disorders or their passion to help pass legislation that might benefit people with eating disorders and their families. So efforts for advocacy around the country relating to eating disorders involves a lot of collaborations with groups that have experiences in state senates and capitals to try and push through legislation that can help the issue. And so I'm going to bring all of that together to say that there's been a pretty significant gap in public health education, as I've mentioned, as it relates to advocacy and translating research into policy. And so at STRIPE, we have developed this playbook, which has been many years in the making, that can help people to become advocates, whether they have zero experience or years of experience, and create and maintain an advocacy campaign. Many of the issues that we'll be talking about today relate to eating disorder related legislation specifically, but of course the tools can be used across a broad set of issues. And so I would encourage everyone to scan the QR code or save somehow, type out and save or take a picture of this slide so that you have the URL handy and can access the STRIPE advocacy playbook on your own time to be able to explore the resources. But I'm going to go through and explain some elements of it today. Once you get to the STRIPE website or the STRIPE Advocacy Playbook, you'll see circled in red on the side on the navigation bar, as well as if you were to scan the QR code, you'd go directly to the front page of the STRIPE Advocacy Playbook. The STRIPE Advocacy Playbook is a free, online, fully available resource that uses established strategies to make it easy for people to advocate for changes that could help prevent eating disorders and disordered eating through legislation. So like I mentioned, it's designed for people who are new to policy advocacy and veterans alike. And to cater the playbook to audiences that can more specifically use its resources, there are 3 different pathways when you first click on that playbook page. There's a pathway to use the playbook for advocates. So people in the community who want to make a difference in their state or their city even. There's a pathway for public health professionals who want to use their skills and resources to pass this sort of legislation. And then there's a section for policymakers and their staff, something that is a little bit more tailored to being a leader to lead initiatives through legislative efforts that would reduce eating disorders. One of the things that you'll find in the playbook is something called the Power Prism. So this is something that Bryn alluded to earlier. The Power Prism is a framework developed by My Power People, and it's a step-by-step plan that helps you recognize opportunities for advocacy and building momentum in a campaign. So there are 6 power tools, which will be briefly summarized in a bit, but they include research and data collection, coalition building and maintenance, fundraising and development, grassroots and key contacts, and media advocacy, and decision maker advocacy. Each page of the playbook in the Power Prism will explain each of these to you in detail and provide you with resources to try and achieve your goals in each of these different realms. The playbook also contains model legislation for a whole range of pieces of legislation, and I'll provide some deeper examples of those in a bit. But first, I'd like to play you a navigation video that gives you an idea of the playbook and what it's like.
Welcome to the Striped Advocacy Playbook. In this video tour, you'll see how to navigate through the playbook to find the resources you need. from model policy and lawmaker meeting tips to step-by-step tools to help you plan your campaign for social change. We'll start by going to the Striped homepage at hsph.harvard.edu/striped. Here, you can find out about Striped, the strategic training initiative for the prevention of eating disorders, and lots of our other projects and resources. From here, we're going to click on Striped Advocacy Playbook on the left side navigation. Note that you can click on the arrow to expand or click the main link. I'll click the main link to take us to the Advocacy Playbook homepage. Here we are on the Striped Advocacy Playbook landing page. We've also made a shortcut for you to get here via tinyurl.com/stripedplaybook. From this page, you can also find links to learn more about our team, our funders, collaborating organizations, a welcome note from Stripe Director Dr. Bryn, and a quick introductory overview of Playbook contents. The Striped Advocacy Playbook has something for everyone, whether you are a community advocate, public health professional, or policymaker. We've tailored a version of the playbook for what will be most useful for each of these audiences. If you're an advocate, for example, you'll click here. Here we are on the Advocates version of the playbook. While you're here, we'd love for you to complete this brief embedded survey to tell us more about you and to stay in the loop about future Striped projects. Once you're done, you can click on the playbook here. Now, we've arrived at the Advocates version of the Striped Advocacy Playbook. As you scroll down, you'll see links to resources, including our glossary of terms and our interactive map, where you can find data on the economic cost of eating disorders in your state. Very helpful information to have when you are meeting with your lawmakers. Back to the playbook, we'll continue to scroll down and take a look at the Power Prism. The Power Prism, a fantastic resource from My Power People, provides step-by-step tools to create a campaign for change. The Power Prism is built on 6 power tools of advocacy that help us reach our policy goals. These 6 tools are research and data collection, coalition building and maintenance, fundraising and development, grassroots and key contacts, media advocacy, and decision maker advocacy. You can learn more about these tools by clicking on the links within this page or in the left side navigation panel. You can also move from one tool to the next by clicking through at the bottom of each page. Here, for example, is the Research and Data Collection tool, where you can read about researching key decision makers, choosing a bill sponsor, and more. If I clicked here, I'd go on to the next tool, Coalition Building and Maintenance. Now, I'm going to use the panel on the left to navigate back to the Advocates homepage. Then, we'll scroll back down to the Striped Advocacy campaigns. You can also get to those from the left navigation.
So the next part of the video begins to dive into the pieces of model legislation that are contained within the Striped Advocacy Playbook. As you saw on that previous slide that I showed you, the image, there are many different advocacy campaigns, but we thought today we would highlight some examples so you can get an idea of the content that's within the playbook and the supporting materials that are there in case you're interested in these pieces of legislation or pieces that are similar. So one of the resources contained within the Striped Advocacy Playbook is materials to support legislation related to the Crown Act, which aims to end discrimination based on race-based hairstyles. The Crown Act was created in 2019 by the Crown Coalition in partnership with Dove, and it's relevant to the mission of the playbook because race-based hairstyles and allowing people to wear race-based hairstyles without discrimination is a matter of body image, body confidence, and of course is relevant to the overall mission of the playbook. The playbook includes model legislation and legal rationale for this bill from the Crown Coalition itself, as well as additional resources that may be supportive as they relate to body confidence and this bill in particular. Another bill is a bill related to a ban on body size discrimination at the state level. So I've included a couple of screenshots here that you might be able to see, including a news summary of different examples of news stories related to size discrimination and actual legal text that lawmakers can use to put forward a bill within their state related to body size discrimination. body size discrimination or experiencing body size discrimination is a significant risk factor for folks engaging in harmful weight-related behaviors. And it's an important avenue for us to consider when we're trying to reduce eating disorders among the population. Other materials contained within this bill section on the Striped Advocacy Playbook include policy papers, fact sheets related to weight and size discrimination, and summaries of the scientific evidence related to this as well. Now, of course, I would be remiss without discussing one of the more developed areas of the playbook, in which Bryn will summarize some of the advocacy work that we've done. And that includes a bill called Out of Kids' Hands to ban the sale of over-the-counter diet pills and muscle supplements, or muscle-building supplements, to youth under the ages of 18 within states. So this is the most developed of all of the pieces of legislation within the Striped Advocacy Playbook. And of course, we will give examples of how it's been put forth in several states. This piece of legislation includes several materials, including science summaries, news summaries, fact sheets, again, sample legal text. And I provided here a little snippet of an infographic that highlights how the diet pill and supplement industry purposely prey on youth of color and individuals with higher weights, and how these products are a threat to health equity. So these are the types of things that I would say are tools for folks who are getting into advocacy as public health professionals that they can take to lawmakers as they hope to implement these types of advocacy campaigns. And there are several other advocacy campaigns, including a campaign or pieces of legislation to provide an excise tax on over-the-counter diet pills, incentives for corporations to stop digitally altering ad images, bans of the sale of over-the-counter laxatives, prohibiting the sale and the use of liquid silicone for cosmetic injections, banning cosmetic breast implant surgery in minors, and promoting eating disorders prevention within schools. So I'm going to hand it over to Bryn now to dive a little bit deeper into one of the examples that I have already mentioned around diet pills and putting the playbook into action.
Great. Thank you, Amanda. That was a terrific overview. So now we are back to diet pills and this wonderful world with all of its contradictions and challenges. What I'm going to start with is returning to the story of odds, arcs, and policy change. If you'd like to take a picture of this QR code or get in touch with us later, we wrote up an article in the Harvard Public Health Review, and thanks to Dr. Alvin Tran, who's actually in the on the audience right now, helped us get this placed in the Harvard Public Health Review, describing our campaign. Next slide, please. We've also published in some of the academic literature, happy to share this, in other publications describing the campaign. So what I'll give you now is a distilled overview of what the issues are and how we've approached it for policy advocacy. So supplements sold for weight loss and muscle building lack medical evidence to support their use. And the American Academy of Pediatrics has come out pretty strong on both of these types of products that should not be used by minors. They're linked with eating disorders, they're linked with steroid abuse, and this is prospective research that has found these associations. They can cause a wide range of health problems, some life-threatening. Supplements, dietary supplements in particular, are so weakly regulated by the federal government and by the FDA that they can be very risky due to adulteration, or in other words, deliberate lacing of the products with prescription medications, illegally introduced products, prescription meds, banned pharmaceuticals, steroids, excessive stimulants, and other dangerous ingredients. These are all showing up in dietary supplements, especially the kind that are sold for weight loss and muscle building or sports performance. And as Amanda mentioned, these products worsen health inequities by ethnicity, by household income, by gender, and other axes of marginalization. Next slide, please. Here's another shot from our fact sheet on health inequities adversely affected by these products and the practices of the industry. Among adults trying to lose weight, African Americans and Latinx adults are much more likely to use these products. Same in households with lower income compared to higher income households, lower income households, and people with less education, so less than high school education, are more likely to use these products. And as many of you may already assume, products are more likely to be used by girls and women than boys and men. but we are also seeing higher rates among transgender and gender binary, non-binary communities. So we're seeing these differences in a number of ways in marginalized communities. Since the start of the COVID-19 pandemic, we have new evidence to show that African American adults are 3 times more likely to start using weight loss supplements than are white adults. And I just want to stop there for a moment to flag that this, like all health inequities, they are not happening by accident. We know, we have evidence that the industry is deliberately targeting BIPOC communities, immigrant communities, lower income communities. In fact, one of the manufacturers has been fined millions and gotten all kinds of charges against it for predatory and deceptive practices of targeting the Latinx community. So we know these industries are working hard to produce these inequities and make profit off of marginalized communities. Next slide, please. Now let's turn to the Out of Kids' Hands campaign. So we have all this evidence of that these products are dangerous, that they're targeting communities, that they're putting kids at risk. So what do we do about it? We started to work with our coalition partners to create the Out of Kids' Hands campaign. And that's what I'll talk a little bit about next. With the Out of Kids' Hands campaign, we'll follow the methods of the policy translation arc and strategic science by building coalitions with other experts in the field, including clinicians, community advocates with lived experience, and with lawmakers and their staff. And this coalition working together can help advise on legislation, amendments to satisfy diverse stakeholders, and its constituents and advocates with lived experience and clinicians also working with people experiencing eating disorders or other relevant issues. They have the strongest appeal for lawmakers. And it's really human nature. We know that constituent stories and the stories of people with lived experience always are more moving and motivating than data. Data can inform policy, and we absolutely want it to inform policy, but it's stories that can motivate policy action. And that's why working across communities, including with clinicians and advocates with lived experience, is critical in addition to working with lawmakers. Next slide, please. So now I'd like to talk a little bit about specific legislation that we're working on. So early on, colleagues in Massachusetts working with the Multi-Service Eating Disorders Association put us in touch with Massachusetts Representative Kay Kahn. She actually had in her previous career was a psychiatric nurse and a pediatric psychiatric nurse. She knew about eating disorders. She knew how serious this was and how dangerous these products are. She agreed to file legislation in the state legislature. This was a few sessions ago, and we've made great progress. And actually this year, next slide, please, we have this legislation also introduced in the Senate in Massachusetts. Senator Mike Rush is sponsoring the legislation there. And in fact, we have similar legislation in California and New York, where the bill has done very well and is now in a holding pattern until both of those legislatures pick up work again. So talk a little bit more about our work in Massachusetts. Next slide, please. The purpose of the legislation is to ban the sale of those products to minors in the state. In November 2019, it's fateful date before COVID really took hold, we had an in-person briefing and policy briefing at the Massachusetts State House, and also had an advocacy day where we put advocates in teams to help to organize them to meet with lawmakers in person and advocate on the bill, much like I know many people attending SOPHE will be doing later this week with lawmakers in Washington. So for this briefing, we had the good fortune to be able to work with celebrity and community advocate Jamila Jamil, who some of you may recognize in this screen from the show The Good Place. Well, she is a very active policy advocate around issues related to body image and eating disorders and health equity and anti-racist and anti-discrimination type work that's all part of her iWay program. In this slide, we have a couple of lawmakers who have been helpful, and it's a shot from the briefing, and we're going to show you a little bit more from that. Next slide, please. Part of what we did when it came time, and we'll start this in just a moment, when it came time to get a vote from the Public Health Committee, this is in the previous legislative session before the pandemic really shut things down, we put out a social media blast for a call to action for advocates, and we created 60-second assets, that is video assets produced to be able to send out through social media to tell advocates now is the time to contact the chair of the Public Health Committee where the bill was, to tell him, please support this bill. We want to see it move forward. So that was part of our media campaign right at the time with a vote. And we worked with a film editor to create these 60-second media assets based on film we took at the briefing. So we had a camera crew there in order to prepare to do this. So Amanda, I think you should be able to play this short now.
I grew up severely affected by the media. All I saw from the minute I first turned on television were, Disney princesses with waists that were this big, and all of the girls who were seen as beautiful throughout the 90s were always emaciated.
My eating disorder started with restricting and using diet pills.
I took all of the diet and detox products.
They were easy to buy. No one knew I was taking them, and they seemed harmless.
I stand here before you having survived 2 decades of body dysmorphia, anorexia, kidney problems, liver problems, digestive issues, fragile bones, damaged fertility, and a weak heart for someone so young. I will never, ever get my health back.
The American Academy of Pediatrics has come out against these, saying children should not be using these products. We need lawmakers to step up and make this happen.
Excellent. Thank you, Amanda. So that was it. We made 3 60-second shorts that pulled out different snips of our briefing to put these together to get calls. And we were successful. This was before the pandemic shut down the legislature. But we were successful in getting the bill voted favorably out of Public Health Committee and moving forward in the process. Now, last year, as many of you know, many state legislatures at some point mid-year just stopped doing any other work besides COVID, urgent budget and police reform type work, and that was true in Massachusetts. But we waited, and now we're back. We had great progress this year in California with the very similar bill, working with lawmakers there, passed key committees in the Assembly, and will be picked up again in January 2022. In New York, similarly, great progress. It actually got the bill passed on a floor vote in the Senate in New York, and it will be picked up in Assembly committees next year in January 2022 when the legislature resumes work. Massachusetts, they don't take a 6-month break in the middle of the year. We actually work for 18 months, and it's currently in the legislature. Just had a meeting, had meetings this week with lawmakers about getting that next vote through to see this bill move forward. Next slide, please. Now, a few lessons learned, and I know you all have a lot of experience around advocacy, so these should be familiar to you. The coalition is critical. The stories are key to motivate lawmakers. So we had a lawmaker tell us yesterday they have 7,000 bills in the Massachusetts legislature this year, 300 alone in the committee where our bill is. And as he said, in Massachusetts, they may support the idea of the bill, but it just can get drowned out by all of that noise from all of the bills. So it's critical to have those stories that can cut through the din and reach lawmakers and their staff and their hearts. Steps 1 and 2 of the translation arc will really focus more on evidence and practical considerations of policy. This is part of the translation arc. Steps 1 and 2, we've got that evidence. We're using it in state houses across the country. Next slide, please. Step 3, that's the one I mentioned, is where you motivate political will and need to inspire action. That's where we're really bringing in the stories. At this point of the translation arc, that's what can get the deals made. Next slide, please. Now, are there ways that any of you or all of you could get involved? You could bring this bill to your state, or if you're in Massachusetts, New York, California, you can get involved in what we're already doing. We have materials to make it easy. If anyone is interested in bringing this to your state, get in touch with us and we can share it, all that we have with you, and be available for any kind of technical support. I wanted to flag a couple of things we're doing with youth this year. The pandemic has made it very easy for us to have youth anywhere in the country involved in our work because they do it through Zoom. We have a youth survey that's led by the youth, and the purpose of the survey is to collect the perspectives of youth to be able to amplify it in communications with lawmakers. The youth survey, you can take a picture of this QR code, or you can get it later on the recording, or use the URL, and youth under 25 can fill this out to share their experience. Next slide, please. We also have a youth support letter. It's a sign-on support letter with youth talking about why this issue is important to them and how they want lawmakers to support the bill. And you can take a picture of this QR code or go to the URL to access the youth support letter. And for this, we're having youth in the key states and anywhere else in the country really can sign on if they want to put their name out there as being in support for this bill. And this is shared with lawmakers, just like the results of the youth survey. Next slide, please.
So one of the key elements of getting youth involved with the work that we do and with the pieces of legislation, including the leading of the sign-on letters and surveys, is allowing them to express themselves and share the messages that they're trying to amplify through the work that they're doing with Striped on platforms and through channels that they would be using to communicate with each other regardless. So I'm going to show you a couple of samples of very brief TikTok videos that the youth have prepared. One video that summarizes some of the issues that the youth faced with the youth survey that they've been collecting data with, as you'll see in a bit, and a second one in which one youth provides an update on the bill out of kids' hands that was introduced in New York recently.
Hold up, we gotta have a reality check. The diet industry, corrupt, and don't believe us? Here's the evidence. We are youth currently working to pass incredibly necessary bills like this in order to protect and prevent minors from the sale of over-the-counter diet pills and weight loss supplements. The American Academy of Pediatrics strongly advises against the use of these products because they often have lethal ingredients that result in hospitalization, chronic illnesses, and even death. You heard that correctly. Now, you would think that adults would want to help protect children from these toxic products, right? Wrong. Starting from April 25th, 2021, diet industry workers and lobbyists attempted to mess with our bill by sabotaging our data. We conducted a nationwide survey to ask youth like you about your experiences and your support of the bills. These lobbyists then flooded our data with over 600 false responses. They deliberately exploited teenagers' vulnerabilities and insecurities. Check out parts 2 and 3 for the rest of our story.
And so I won't be showing parts 2 and 3, but just another demonstration of a video. That was Joanne, a Striped Youth Corps member, and I'm about to show a video from Kelsey.
Smooth like butter, like a criminal undercover. Don't pop like trouble, breaking into your heart like that. Cool shade stunner, yeah, owe it all to my mother. Hot like summer, yeah, I'm making you sweat like that. Break it down. Ooh, when I look in the mirror, I'm not too hard to do. I got the superstar glow, so ooh, do the booty. A side step right left to my beat. I like the moon rock with me, baby. Know that I got that heat. Let me show you 'cause talk is shit. Side step right left to my beat. Get it, let it roll. Smooth like butter, pour you in like no other. Don't need no usher to remind me you got it bad.
And so this is just a brief demonstration of the kinds of materials that the youth prepare themselves that we can then take to lawmakers and that other youth within the states and the regions of these lawmakers can actually take a look and become informed. And so just, I want to quickly revisit it because I know that we're running out of time and we'd like to open it up for questions. Hopefully we've achieved our aspirations for this talk, which are to convince you that evidence-based public policy, that to advance that type of policy, public health professionals must become well-versed in the methods of strategic science and use them, and that diverse stakeholders have unique and essential roles for success. Really briefly, I'm going to show you again this slide to check out some resources on our website and to bring this bill and others to your states in 2022, as well as the contact email for Striped. And that is all from us. I guess we can open it up now to questions, and I'm going to stop showing my slides.
So thank you all so much for a very informative presentation. And we would like to open up the discussion to questions. You all can post your questions in the chat, or if you're feeling extra brave, you can unmute yourselves and ask your question live.
Thank you, Sabrina, and thank you, Amanda. We actually had a question in the chat of how people can see the TikTok videos. And I know we have a URL that goes to the first 3 that are part of a triptych. We can post some of the links.
Sure, I will do it. I'll do a quick hunt for those links now.
Okay, great. So you'll see them in the chat soon.
Thank you all.
Great. Well, while we're waiting for people to asked the questions or put them in the chat. I just wanted to share a little bit about how the experience of working with the high school students this year. Previous to the pandemic, it's with Stripe, I mean, based in Boston, we've had high school students reach out to us, but it's often was difficult because we're not a youth provider type program. It was difficult to find ways to have them link in. But once everybody and the high school students all became super facile at working with Zoom or online platforms, as did we, in response to the pandemic, we realized we can really open this up to youth anywhere in the country. And we connected with a few youth-led organizations in New York and in California, and that really opened up a whole new program for Stripe of being able to work with youth who are really motivated to do civic engagement. I know there was a talk this morning at the very opening of the conference in the poster section about how young people, high school age and college, many are very motivated to do policy advocacy, and they want to start now. They want to get involved now. And that's been so encouraging and motivating, inspiring for me, and I know for Amanda and others of us on the Stripe team to be able to have this opportunity to work with amazing youth like Joanne or Kelsey or many others who've worked with us through this year.
And perhaps you see the question in the chat, but I will read it aloud. How do you navigate mental health concerns with involving youth with working with minors?
Great question. Amanda, how about if I start and then do you want to jump in with that? This is definitely a concern. And that was one of the reasons that I was a little hesitant about working with youth originally. Often the youth who are most interested in working with us are struggling or have struggled or have close friends or family who struggle with these issues. And they're very serious. Eating disorders have the highest mortality rate of any mental health condition, save perhaps opioid dependence. So this can be very, very serious. We are not clinicians, but we work with a lot of clinicians. So we've got some experience with being able to be careful about this. In general, we've talked to youth, the youth that are more engaged, we talk to their parents and we talk to them about their readiness. We never are putting pressure on youth. At times they may need to they need to focus on school, but sometimes they need to focus on recovery and then come back to us. We're not a service provider, but when we're concerned about somebody, we can check in with them or their parents and make sure they have access to services and support where they are. But thank you for that question. I know, Amanda, you have a lot of experience working in community organizations with youth. Did you want to add something?
Yeah, and just to build on what Bryn had mentioned, a lot of these youth have quite a bit of enthusiasm to get involved and are very passionate about this subject. So even for some of them, if they're feeling like their mental health is not at the capacity that it should be to do this type of work, they still feel like they'd like to get involved. So as Bryn mentioned, frequent check-ins with the youth. If we find that youth are, for example, doing too much work or volunteering to take on too many tasks or missing out on certain sessions, then we will often check in with them. And as Bryn mentioned, there is communication or at least some initial correspondence with their parents to ensure that their parents know that they're involved in this work as well.
And just for our for closed captioning purposes, I will also go ahead and read the next question that just got posted in the chat. Is it possible that rules and policies can become extended so much that they become restrictive? How does Stripe ensure policy advocacy is accompanied with other strategies to prevent people or constituents from perceiving policies as being too restrictive?
Oh, an interesting question. I think with this particular issue, it's pretty clear that these products should not be on the market at all. There's not any ambiguity about the consequences of having a very poorly regulated market in dietary supplements, and the evidence is just, it's a mountain of evidence about the dangers of these products. So in this case, I'm not as worried about if we stop selling the products to youth, if we succeed in that it's going to be too much restriction. In fact, nobody should be using these products, but we're not working to keep them out of the hands of adults right now at the state level. However, a much more complicated issue that we have done some legal work, legal research, I should say, legal research on, but is not an easy closed, shut, easy, open, shut, what's the expression, kind of case, is the issue of cosmetic breast implants in minors. And Amanda mentioned this as one of the areas where we've done legal research. Now, the cosmetic breast implant industry has really pushed hard to try to get minors or their parents to approve them getting breast implants for a 15th birthday or 16th birthday, or to celebrate your womanhood. They're clearly marketing on sexist ideas about what a woman should look like and trying to expand the market. The younger they go into the teen years, it expands their profits. There's real problems with that. And these products, if you're not familiar with them, they can be dangerous to do the surgeries, and they have to be replaced. It can be 10 years or more frequent, they have to be replaced. If someone gets them at 16, they may be looking at multiple surgeries, all paid out of pocket for the rest of their life if they keep these. However, the complication, if we were to just go full steam ahead on that, the complication is the situation with gender affirming surgeries for transgender young people. And we know just in the past year, especially, state legislatures around the country have come down really hard on trying to deny healthcare access for transgender youth. And that's it was a huge issue just a few months ago, where state legislature after legislature was introducing bills like this to prevent them from accessing gender affirming medical care. Now, we would not want our legal work to be used by these conservatives who are trying to deny the basic rights to healthcare and human rights of the transgender community and transgender youth. They don't care about the exploitation by cosmetic surgery and implants type companies. They've got a completely different agenda. For that one, there is not an easy answer, and it's an area we're doing more work and work with communities to figure out how do we continue to work in that area without inadvertently giving fuel to the conservatives who want to deny the basic human rights and healthcare access for transgender youth.
Thank you all for that. And thank you once again to our audience members. Thank you to our presenters. We've had such a fascinating time and engaging conversation with you all. I look forward to being in touch, and have a wonderful afternoon. This now marks the end of our session today.